the stress of not knowing. Welcome back to Get Connected. I'm your host, Con Jackson. It's now time for our Health Beat segment. Many people are diagnosed every year with cancer. That diagnosis to treatment, that period could be quite stressful. But one organization is making an impact in that area, and Steve joins us now live to tell us more about it. Welcome to Get Connected.
It's great to be with you, Con.
Well, Steve, it's great having you with us, and first and foremost, thank you for all that your organization does.
Well, thank you very much. There's nothing of a higher calling we can think of than trying to help cancer patients find the best path to their cure.
Well, Steve, we all pray for a cure. I'm just curious, how many people in America are diagnosed with cancer each year?
It's well over 1 million people a year now, just in the United States, and approaching even 1.5 million.
Wow, that is certainly very alarming. But tell us about the Cancer Treatment Centers of America.
Well, Cancer Treatment Centers of America is a fairly rapidly growing network of hospitals that are dedicated entirely to cancer, and we tend to specialize in the most complex and later stage forms of the disease. So we offer a very intense array of up-to-date traditional therapies, chemotherapy, radiation, and surgery. But then we surround that with a very sophisticated array of complementary therapies to manage side effects and to support the immune system. And we integrate all that care together in ways that we think offers the highest level of hope and the broadest array of healing options that cancer patients can find.
And I would assume another great benefit, Steve, is the amount of information you can share with all your hospitals and patients.
Well, we do provide a lot of information, and as you're suggesting, the typical cancer patient has an enormous appetite for information, and that's where their quest begins once they get this diagnosis. As soon as they're diagnosed, they want 4 things. They want to know as much as they can about their cancer, they want to know what their treatment options are, they want to know what it's going to cost for their care, and they want to know how quickly they can get started. And the way the market works is there can be some significant delays built in while they get all the information they need from diagnosis to get into active treatment.
One of the great things I've heard about your center, Steve, is that the patients aren't treated as numbers, but rather as people.
Well, that's absolutely right, and of course that's what they are. But we believe that a very personalized style of care is therapeutically important. It's very effective. It makes the patient feel energized, feel drawn into their care, feel motivated by their care, and in control. And what we've done now with this new Care Edge offering works with this challenge on the diagnostic level, where we offer, before they come, a complete listing of what we will include in the diagnostic phase. We guarantee that their complete diagnosis will be conducted in no more than 5 days. And we give them a fixed price, and then at the end of that, they also have from us a personalized care plan that outlines all these options for care that are relevant to their cancer, and they can come to us then to implement their care, or they can take this care plan and go somewhere else to get the care that they value.
That's great, Steve. And what are you guys seeing in the industry that you guys are trying to improve on?
Well, what we've seen in the market up until CTCA's introduction of Care Edge is that people get the diagnosis and then they get referred to an expert. And they have to call for an appointment, wait for the appointment, then they go in for tests, they wait for the test results, and with the advancing precision, oftentimes they'll get referred to another expert for another appointment and more tests. And it can take weeks and sometimes even months from diagnosis until they're ready to get into active treatment.
So you guys are streamlining the process of treatment.
Exactly, and obviously the longer you wait, the more opportunity the cancer has to continue to grow, but it's also very debilitating from an emotional point of view, a psychological point of view for the patient, and that also drags down their immune system and keeps it from engaging and fighting the cancer, as well as these other therapies that we can bring into the patient.
Steve, how can our viewers learn more?
If they'd like to know more about Care Edge, we'd invite them to the CTCA website, which is located at cancercenter.com, and that's just one word, cancercenter.com.
And before we go, I know it's called the Cancer Treatment Centers of America, but you guys are all around the nation?
That's right. There are Cancer Treatment Centers of America hospitals in Phoenix, Tulsa, Oklahoma, outside of Chicago, Illinois, and in Philadelphia, and we just broke ground and are building a new center in suburban Atlanta.
Well, we're certainly blessed to have one of your centers being built here. Thank you again for your leadership and the valuable information that you shared with us today.
Well, thank you, Con. It's great to be with you.
If you want to check out other Health Beat segments, come on, log on to our Get Connected website at contv.com. Improve your health, it's sure to improve your happiness. We'll be right back.